specialist from UC San Francisco. And Dr. Chin Hong, we thank you for joining NewsNOW from Fox, as always. I'm just kind of curious as well, what do you think, with Biden issuing all of these executive actions surrounding COVID-19, have we made any progress in almost a year's time? I was reading that the CDC confirmed the first COVID case 1 year ago today. Where do you think we've stumbled? Where do you think we've succeeded in coming up on that 1 year anniversary?
So I think there are two main areas that we stumbled on, Andrew. There are essentially two things that I'm hoping the new administration would remedy. And from all intents and purposes, it seems that that's about to happen. So these two factors are a national strategy. So, in that tome of COVID, hopes that the new administration is setting, that is a national strategy and something that we really wish we had for a very long time, because it was like a heart was beating, but it was beating in asynchrony with different states acting like different countries. And of course, the virus knows no borders. The second issue is that we have an alignment of science and politics. At least science informs politics and policy, and I think that will go a long way again even though we've already lost, unfortunately, a lot of lives, we can hopefully, soften that next phase where we still expect thousands of Americans to die.
Yeah, that's right. And you mentioned that great milestone we hit just a couple of days ago, 400,000 Americans dead. I want to go into some of these executive actions that President Joe Biden is taking. He's requiring masks to be worn on all federal property, masks to be worn in buses, trains, airplanes. But one of them today that he issued, he wants to essentially, for all international travelers coming in, to get a negative test and quarantine. Dr. Chin Hong, that seems like something that really should have been done March of 2020. It seems like we haven't really, progressed a year later. We're still doing things that, we've been doing for a year. So are you optimistic? A lot of Americans, when they hear a lot of these executive actions, they're like, right where we started, essentially.
Yes, it seems like Groundhog Day all over again. I think the quarantine idea is a good one in principle, but it's really tough to enforce. It's similar to when the tri-state area went on quarantine, but you can just drive in your car into New York City from, Pennsylvania, and, nobody was watching. It's really honor code. Other countries who have been successful at quarantining and border control with disease have, had electronic ways of checking into people. Particularly some Asian countries, I think that probably would not sit well with, individualism and privacy concerns here, but it is a good gesture. I'm not really sure if it will actually result in much. The virus testing at the borders is a good thing that I think could be enforceable, because either you have it or you don't. That worked in Hawaii, so it could work for the continental US as well.
And just to go into some more of these executive actions, President Biden is directing FEMA to expand reimbursement to states to fully cover the cost for National Guard personnel and emergency supplies in getting more people the vaccine. He wants to vaccinate 100 million people before his first 100 days is up. So let's talk about the vaccine. One of my main questions is, we're trying to get to this herd immunity. We've heard Dr. Fauci say 70 to 85% would be ideal. But, for those people who have already gotten either the first or the second dose, now, compared to in the summer and the fall of 2021, does that kind of make all of the vaccinations moot from your standpoint? Is it helpful, or once again, will we be starting from square one with vaccinations? How long will that immunity last?
Yeah, so the initial phase of the vaccine rollout at the highest tier risks in two ways. Those who were taking care of the sick people, so the healthcare workers not just any healthcare workers, but those at the front lines were prioritized. And the second group were those who were at risk of getting very serious complications and dying, nursing home residents and other congregate housing arrangement inhabitants. I think that probably didn't put a dent as much into the numbers. Of course, the numbers continue to rise in infections and in deaths and hospitalizations, but it did keep the healthcare worker force well in general during the surge, particularly in California where I live. I think we couldn't have done that. Probably a lot of people were already going home sick before the vaccines came. Since the vaccines, I think it's kind of flattened that loss and attrition of healthcare personnel. So yeah, it seems like we're starting all over again, but yet, I'm still hopeful. I think one of the unknowns is really whether or not the new variant, not just the UK and South African variant that we've been worried about, but the new one described in California that's now accounting for 40 to 50% of cases in some regions of California, like Southern California. If that's going to fuel a mini other surge, I'm hoping not. But these are all considerations, particularly if you have a more transmissible variant, it may require a higher level of herd immunity. That's where you get the 85% versus 70% for the regular COVID.
And in your view, do you think these variants and kind of the original COVID-19 virus, do you think they've gotten weaker over time, even though they are some of the variants definitely more contagious? And I kind of just wanted to ask as well. We can answer that question first, and I'll bring up another question.
I mean, getting into the mind of the variant is an interesting exercise. So evolutionarily, I think the virus just wants to persist as much as possible. So if it kills off the host, probably it's going to be a dead end. So it's interesting that the ones that are surviving and thriving are the ones that are so easy to transmit because they're stickier and they stick to you more like Velcro, but don't make you so sick that you can't transmit it to other people, is an interesting thought exercise. We do know the virus is very sloppy. Every 2 weeks it's mutating, and it's not really intending to do anything per se, and it's really because it's error prone that sometimes it results in something that makes it thrive better than its ancestors.
Dr. Shin-Hong, just lastly, I wanted to ask your opinion as well, just kind of from a health policy standpoint. There had been so much talk back and forth in the last days of the Trump administration about, should we kind of, not reserve the second dose and kind of let the people who are eligible to have it, essentially eliminating that reserve of the second dose. In your view, was that a smart move, or should you have separate reserves for the first and the second doses? And what's your view about the vaccination rate at the moment?
Well, first of all, I'll start with the second question first, because I think my answer to that is simple and sad, which I think it's appalling that we haven't been able to vaccinate as many people of the doses allocated to various states. Some states are doing better than others. New York, Florida, certainly West Virginia and New Mexico and North Dakota are doing better than California. Maybe a factor of size of the state, terrain, rural areas in California, and the vast geography. But at the end of the day, we're failing because we haven't invested in public health, and we've glamorized the science, which is so totally important. But you can't, wear one shoe when you're leaving the house. You have to wear two shoes. So, asking for $8 billion and only getting $340 million in the first round for public health planning was probably not the best move. So, I'm hopeful though that, we can at least align. And in terms of that first versus second dose issue, I do think we'll have enough stocks right now to get that second dose in and still get that 100 million people in the first 100 days, even though some people even think it's too small because we have J&J coming through and increased production by Pfizer, Moderna, and possibly the wartime effort production line increase. But at the end of the day, I think most people in healthcare in this country want to go and adhere to the science, which is we kind of want to do exactly what the trial said, to have the best benefit and to expect that 95% response.
All right, as always, Dr. Peter Chin-Hong of UC San Francisco, we appreciate you taking the time to come on to NewsNOW and explain all this and break this all down, as it will be quite difficult in the months ahead, as a lot of our federal health officials have been saying. So, thank you.
Thank you, Andrew.
See you again. All right, and we are going to cover all of these angles on the coronavirus, as we always do here on NewsNOW from Fox. And we just wanted to reiterate again, 1 year since the CDC announced the first COVID positive case in the United States. At the moment, we are going to take a quick commercial break. We have an interesting live report coming up from Phoenix, Arizona, right here where we're based, about farmers and the country's lettuce supply. So we'll bring you that story.